Hello, I am Rhyan Hewlin, a graduating senior at Fisk University. For a year now, I have served as an HBCU Wellness Student Ambassador for Meharry Medical College. As an ambassador, our mission is to educate the community about health disparities that negatively affect individuals daily. I chose to bring awareness to diabetes and focus on how college students are more at risk for developing diabetes if they gain the notorious freshman 15 once entering college. The title of my presentation is Diabetes Awareness, Decrease and Lower the Risk of the Freshman 15. Diabetes is a chronic illness that affects how the body uses food to produce energy. In order to produce energy, the body breaks down the food we eat into glucose and releases the glucose into the bloodstream. When your blood sugar level increases, it signals for the pancreas to release insulin. Insulin then enters the body's cells and is used as energy. A person who suffers from diabetes either cannot make enough insulin or can't use the insulin that is produced in their bodies as well, which results in high amounts of blood sugar in the bloodstream. Over time, this can cause very serious health problems such as heart disease, vision loss, and kidney disease. Severe acute respiratory syndrome, coronavirus 2, has caused various problems in healthcare starting in December of 2019. According to a paper entitled Diabetes Mellitus and COVID-19, Understanding the Association in Light of Current Evidence, COVID-19 causes hyperglycemia in an individual with diabetes, which may be related to insulin resistance and destruction of beta cells during SARS-CoV-2 infection. As of now, there is no cure to prevent the development of diabetes. However, a change in diet, losing weight, and implementing physical activity in your daily regimen can reduce the risk of diabetes. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction. It's usually diagnosed in children, teens, and young adults. Type 2 diabetes occurs when your body can't use insulin well and can't keep blood sugar at a normal level. It develops over a long period of time and is usually diagnosed in adults. Gestational diabetes develops in pregnant women who have never had diabetes. It usually goes away after the baby is born. However, it increases your risk to develop type 2 diabetes later in life. The scientific problem. More than 37 million people in the United States have diabetes, and 1 in 5 of them do not know that they have it. The purpose of my project is to educate college students about the prevalence of diabetes in our bodies through genetic factors, diet, and exercise. The expected outcome of my research is to help increase the knowledge of college students about diabetes and genetic factors associated with the disease, and inspire students to get tested for diabetes if they feel they are at risk. Participants were sought to attend a virtual session taught by Dr. Elizabeth Stewart about the importance of diabetes awareness. At this session, Dr. Stewart taught about genetic factors, diet, and exercise regimens. The results from my presentation are the following. This study found that 29.2% of the freshman college students who attended this event were able to gain relevant knowledge from the informational session. After attending this session, 30.4% of the freshman students said that they knew what diabetes was. 33.6% of my participants disclosed that their annual household income was less than $25,000 a year. This shows that some students were not fortunate to come from affluent households and resorted to eating unhealthier food options to be more resourceful. My conclusion: the creation of a virtual event to promote awareness of diabetes allowed college students to gain relevant information. The students were also taught to look for certain signs, symptoms, and genetic factors associated with the disease to become more aware of risk factors. This event educated a large population of college students about the importance of diabetes awareness. Finally, I would like to thank the people and organizations that have helped me with my research thus far. Thank you.